Another surprising decision coming out of the Ford government today, and this one will leave the government trying to figure out how it will come up with hundreds of millions of dollars it planned on saving by making cuts to public health units across the province. I'm Cristina Howorun, and today, 5 weeks after the province quietly told cities it was slashing their funding for public health, Premier Ford changed course.
We've come up with a conclusion that we're going to work together. We're going to maintain the funding throughout this year. Every mayor I talked to said they can find savings, so that's good news. But they said they needed more runway.
That's putting it mildly. On Friday, the large urban mayors caucus of Ontario, representing 2/3 of the province, decried the provincial government's slashing of millions of dollars mid-year from public health budgets, saying it would result in major cuts to services or increases to property taxes. Over the weekend, Toronto Mayor John Tory canvassed parts of the city, denouncing the planned $100 million plus cuts to Toronto public health this year. Cuts that would potentially impact programs such as student nutrition, immunization, and vaccine surveillance, amongst others. It was just the latest move in what has been a chorus of complaints across the province.
To the tens of thousands of people who signed petitions, made phone calls, knocked on doors, this victory would not have been possible without each and every one of you.
But that doesn't mean the transformation, which includes reducing Ontario's public health units from 35 to 10 and dramatically changing their funding structure, is completely axed.
It's not business as usual. We have to pay down the deficit, and we're doing that in a responsible and reasonable manner.
But planned cuts to public health, municipal childcare, and land ambulance this year aren't happening this year.
For the most part, those three program areas represented about a cent or less in terms of a municipal operating budget. In saying that, that doesn't change the fiscal health that the province is in. We still need to maintain our resolve to get ourselves in a better fiscal situation, and we're committed to doing that as a government. The message today is I think there is only one taxpayer.
And that means the province is looking to cities to find savings ahead of next year's budget. They've offered cities more than $7 million to do line-by-line spending reviews. Still, Cressy says the province's pre-planned cuts are now off the table.
In a phone call from the Premier this morning to our Mayor directly, and in follow-up conversations between the Premier's office and our city, we have been told that the future cuts to public health, where they were reducing the cost share to 50-50 for the city and to 60-40 or 70-30 for others, is now not on the table, but rather they're going to engage in a real consultation with cities and public health units to see what the best way forward is.
Now, Ford could not say how much this reversal will cost the province. In fact, we asked his staff several times today for that figure, and they weren't able to provide us with one. But last week, the Financial Accountability Officer said if this government is to reach its goal of a balanced budget over the next 5 years, well, they're going to have to find another $6 billion worth of cuts.